Imagine spending your 20s and 30s dealing with irregular periods, cystic acne, coarse hairs on your jawline, and weight gain you can't explain, only to be told by 4 different doctors it's just stress or normal aging. Then imagine learning that mainstream medicine finally admitted they got the entire condition wrong for over 40 years. If you're new here, I'm Dr. Bryan, retired MD and founder of Health Without Risk. On May 12, 2026, a massive global consensus of over 14,000 patients and specialists officially threw the name PCOS into the trash can. It has been formally renamed PMOS, Polyendocrine Metabolic Ovarian Syndrome. This isn't just cosmetic rebranding. This is a long overdue clinical correction for a condition affecting 1 in 8 women. Here's the scoop. Polycystic Ovarian Syndrome was a complete misnomer from day one. You don't have ovarian cysts in a pathology sense. What shows up in an ultrasound are just tiny fluid-filled immature follicles or cysts that got arrested, stuck at the starting line, because your hormones didn't give them the green light to go ahead and ovulate. And then, get this, 20 to 30% of women with this condition don't even have that ultrasound finding. Medicine named a massive whole-body metabolic condition after an ovarian trait that nearly a third of patients don't even have. Because it was called a reproductive issue, women were historically only asked one question: do you want to get pregnant, yes or no? If yes, Clomid, metformin, others. If no, the birth control pill to mask the cycle. And lately, a prescription for shots handed over like it's a cure, treating a name and completely ignoring the actual underlying mechanism. The new name, PMOS, changes the entire starting line. It proves this is a whole-body endocrine crisis driven by insulin dysfunction, chronic inflammation, and environmental stressors. When that global consensus changed the name to Polyendocrine Metabolic Ovarian Syndrome, they were trying to fix a deeply fragmented system. Think about how a woman actually experiences this condition in the real world. She has cystic acne, so she sees a dermatologist who gives her topical treatment. She has irregular cycles, so a gynecologist puts her on the pill to produce a fake forced monthly menstrual cycle. She gains weight, so her primary care doctor tells her to eat less and move more. Not a single one of those specialists connects the dots because the old name told them to look strictly at ovaries. But look at the words in the new name, polyendocrine. That means multiple hormone axes are completely out of sync, including your adrenal glands, your thyroid, and your pancreas. Metabolic, this is the smoking gun. As many as 88% of women with this condition show a measurable alteration in insulin metabolism. PMOS is a metabolic fire wearing an ovarian mask. By centering them on metabolism, we finally stop focusing exclusively on a single life stage, the fertility years, and start looking at how this condition alters a woman's physiology across her entire lifespan.